Hey, what's up guys? It's me, the PsychNPDavidC. So I worked as a psych RN for over 6 years, but working as a psych nurse practitioner hits a lot different. The first 6 months of working as a psych NP has been more challenging than like any other thing that I've experienced. Like your confidence level is gonna reset and slowly start going back up. You're gonna have what's called imposter syndrome. You'll start to feel really good when your patients start doing well, but you'll also start to feel bad when your patients aren't doing very well. And there's just some unexpected challenges and a lot of things I wish I knew earlier. Let's talk about it. So just as a brief background, I worked as a psych RN for over 6 years. I started with just my associate's degree and I got my bachelor's degree and then I became a psych NP. The first 6 months of a new job matter a lot more than some people realize. Because that's when you make the most growth. You learn how everything works. You learn how to do your job, basically. You know how a lot of people say, like, you should try a new job for at least 6 months to a year before you consider, like, quitting or switching to something else. When you start working as an MP, you kind of get, like, a shift in identity. Like, you're not just the nurse who's following doctor's orders anymore. Like, you're the one who actually makes orders. So your degree and sense of responsibility goes up like crazy. So let's start with the emotional roller coaster that you're gonna be on in the first 6 months of working as an NP. So for me personally, as a psych RN, I felt really confident and competent in like my knowledge and skills as an RN. I wouldn't go to work with any kind of like anxiety. I already knew what to expect, how to handle situations if patients were to do this or this. But starting as an NP, you're not gonna feel any of those things. You're doing so many different things. Like you have to make diagnoses for the first time on real patients. And there's like hundreds of diagnoses and you can only pick a few for each patient. Like for example, you think there's just like major depressive disorder, right? But there's like specifiers you need to add on, like major depressive disorder severe, major depressive disorder severe without psychotic features, major depressive disorder severe with psychotic features, and the list goes on and on. So during the first 6 months, you're gonna be overwhelmed with all these possible diagnoses. Eventually, you'll learn to just like trust your instincts and your gut for the most part. Obviously, you have to make sure the patient still meets the criteria for each diagnosis. But at first, you're gonna be overwhelmed with like all the possible diagnoses that the patient could have. And then let's say you have a patient who's in like a depressive episode, but then they also say that they've possibly had a manic episode before. So like, do they have major depressive disorder or did they actually have a manic episode, which makes them meet criteria for bipolar 2 disorder? And it's tricky because this is pretty much all subjective, really depending on what your patient says. And then to be completely honest, the first couple of months, I was really like dissecting each diagnosis by each criteria to make sure the patient meets every single criteria for the one that I picked. But after a while, I realized I was taking way too much time just deciding which diagnosis to pick. It was taking time away from my other things I had to do, like documentation and even like seeing other patients. So eventually you kind of learn to just narrow it down to like a couple and then you just pick which one is like a better match for them. Well, that's how I do it anyway. This is when you're probably going to start feeling the imposter syndrome too. You're probably going to feel like you're not even properly equipped with like the knowledge to be diagnosing these patients. I mean, even though you technically have a license from your state board and all that, but like you yourself as a person don't feel ready at all. But it is normal to feel like that, especially in your first 6 months. If any nurse practitioner tells you they didn't feel that way, I don't know if they'd be like telling the truth or what, but yeah. And then also contributing to the emotional roller coaster is just the stress and cognitive load that you have to go through. A lot of times, if you're a new NP, your job will like give you patients very slowly onto your caseload. Like instead of booking you with patients like back to back to back on every single hour, they'll give you like maybe a couple breaks here and there just to make sure you're able to catch up on your documentation and all that. But yeah, they're gonna add on more patients to your caseload like slowly over time. So you're gonna be seeing a lot more clients in a short amount of time. And then if you're working a W-2 job, which means you're getting paid hourly, your employer might just book you with like patients back to back to back to back every single hour. And then they might only give you like 20 minutes for a follow-up and like 40 minutes for a new patient. So literally that means you get 20 minutes to review your patient's chart, talk to the patient, and do your documentation afterwards, all in 20 minutes. before you have to go see your next patient. So you're going to be like researching your patient, you talk to the patient, and then you try to do your post visit documentation as fast as you can. And you're like, oh crap, I have another patient coming in like 5 minutes, but you're not done documenting. So you have to go research your next patient and talk to them and document on them. And you might not be finished documenting on them before you see your next patient. So now you're backed up on 2 previous patients while you're seeing another patient. And then all that kind of just adds up throughout the day. And then you might just get stuck just finishing documenting on everything at the end of your shift, and you're not getting paid for those extra hours that you spend overtime. I've heard a lot of stories from new grad NPs that actually have to do that. Like they'll stay over their assigned work shift just to finish documentation, and they don't get paid for those extra time. Like, yeah, you're gonna get better over time and quicker and more efficient with documentation, but for the first 6 months. But if you're fully booked with patients, that's probably going to happen too. So your brain is constantly running at like 100% throughout the whole day. Even during like your 30-minute lunch break that you get, you're going to be thinking about finishing up on documentation on your other patients while you're eating your lunch. And then you're also going to realize that you don't know everything, because nobody can really know everything, especially when you're new. So you realize that you just have to know how to find the answers to the questions you're looking for. Whether that means like asking your coworker NP or asking your collaborating psychiatrist. And I'm not condoning this one, but also just asking AI. Like learning how to utilize all these resources that you have in a quick and efficient manner will make it a lot easier for you. And then next up, there's also the workflow shock. Your documentation style as an NP is going to be very different than documenting as an RN. As an RN, it's a lot more casual. You're kind of just like documenting your assessment, like patients doing this, they're showing this, blah, blah, blah. But as an NP, you have to write a lot more concise and especially defensible notes. Now, what do I mean by defensible? You have to think of it as if like the patient tries to sue you after you see them, and then they're going to end up reading your progress notes in court or whatever. So let's say, for example, you start a new patient on Lamictal, which is a mood stabilizer, with a very low risk of what's called Stevens-Johnson syndrome, which is basically like uncontrollable rash. It doesn't happen very often, but when it does happen, it's pretty severe. So whenever you start somebody on Lamictal, you always want to start at the lowest dose just to make sure they don't develop any signs of rash. So let's just say you start them on 25 milligrams and you say, just take one once a day. Obviously, you'll type the instructions on the pill bottle, and then you'll also have to document in your progress note like, oh, instructed patient to only take once a day, instructed patient not to alter dose without consulting provider first. Because let's just say like they end up not feeling anything and they're like, oh, well, I'm not feeling anything, so I'm going to take 4 today. And then they end up getting like a really severe rash, which is Stevens-Johnson syndrome. And then they try to sue you because they're like, oh, well, they didn't tell me I was only supposed to take 1. So if the court or whatever ends up reading your progress notes, you want to make sure you write like, I instructed patient to take only once a day, blah, blah, blah. So, you know, your behind is covered. So yeah, you're definitely going to learn how to write more defensible and concise notes as an NP. And then you also have to learn new time management skills. In addition to seeing your patients in every time slot that they're scheduled and having to document all those patients, you know, sometimes you'll get messages from your clinic saying, oh, like this patient called and they need something. Or you'll get a call from a pharmacy and be like, oh, this patient's prescription isn't covered. Can we get something else? Or you'll get a fax from somewhere that they want you to fill out, and just a lot of random small things like that. So you're going to learn how to balance seeing all your clients and handling their documentation while also handling all these other miscellaneous things that can happen unexpectedly. You're most likely going to be very overwhelmed at first, but after 6 months, it should get a little bit better. Like you'll find your own routine on, you know, when to do things, on how to do things. So when these things pop up, you'll know what to do. Like, oh, I'll just do this later, or maybe I'll just do it real quick before I see my next patient or whatever. The first 6 months aren't just going to be bad things though. You're also going to have good clinical growth moments. This is kind of when some things just finally click. Like you'll start noticing how to better differentiate between like major depressive disorder and bipolar disorder, or anxiety versus ADHD. Or like when a patient starts complaining of side effects, you'll just automatically know what to do. Instead of having to like look over their entire chart and be like, oh, well, it could possibly be this or this. You'll just be like, okay, it's this that's causing that. So let's, you know, decrease the dose or whatever. So you'll get less situations where you're just like, what do I do? And then you'll slowly start getting into more situations where you're like, okay, I know exactly what to do for this patient. And then you're also going to have your first big wins with your patients. Like, for example, I had a patient come in who's like 21-year-old 19-year-old female. She said she was feeling depressed and also hearing voices, and she's never been on medications before. So I learned how to differentiate between major depressive disorder with psychotic features versus like schizoaffective disorder. I started her on an antidepressant, and then like 4 weeks later, she said she wasn't feeling depressed anymore and stopped hearing voices too. So that's when you're kind of just like, yes. It's really those moments that boost your confidence. Like when you see that a patient you've been seeing has been making big improvements over time while under your care, you're gonna feel very good about yourself, not just personally, but like professionally. These moments are gonna help build your confidence, especially within the first 6 months. Now let's go into some unexpected challenges you'll encounter in the first 6 months. One of those challenges is emotional boundaries. You're gonna have to get used to being a patient's primary provider for like pretty much the rest of their lives. As an RN, you only care for the patient that you see on your shift for the most part, and then you almost never see them again. But as an NP, you're gonna be seeing a lot of the same patients over and over. So if you have a patient that you've been seeing regularly and they're actually getting worse under your care, you're gonna feel like crap. You're probably gonna feel like a failure. Your confidence level is gonna go down. You might start getting imposter syndrome again, like how am I even in this position? You're gonna end up thinking about them like after work hours. So you're definitely gonna have to learn like strategies or have a lot of hobbies just to learn not to take work home with you. And sometimes you'll get very complex patients where they've tried literally every medication, they say nothing works, and you just don't know what the heck to do. I actually have one patient who's like this, and I was consulting with my collaborating psychiatrist, and he told me to get the old records from her previous psychiatric provider. I've called them like literally 5 times asking for them to fax us the medical records. Like we've already faxed them the patient's consent form for release of information. Every time I call them, they're like, oh, we didn't get any like fax consent form, so we can't do it. So you're gonna run into these types of situations too, which you're gonna like aggravate and annoy you. So yeah, there's gonna be a lot of unexpected challenges like these ones, especially in your first 6 months working as an NP. Now let's discuss things I wish I knew starting in month 1. You're not gonna feel confident at first, and that's normal. You don't have to fix everything in one visit. Medication changes take like weeks or even months, so you're not gonna see much progress for at least a couple weeks. And although sometimes your communication skills matter a bit more than your medication knowledge. Because if you're talking to a patient and you sound really unsure of the medication that you're prescribing, the patient is going to feel unsure about it too. Like, let's just pretend your provider's like, well, I think this medication is good for you because yeah, it's for depression. So yeah, take this one. As opposed to if they were like, oh yeah, take Zoloft because it's really good for depression. We'll start low and then we'll eventually start going up. It's going to take a couple weeks for you to notice any changes, but that's just part of the process. So yeah, definitely patients will feel a lot more comfortable and confident in their progress with the way the second provider was talking to them, even if you both start them on the same meds, same dosages and all that. And then also learning how to manage your workflow is more important than how much you know, especially in the beginning. Because in the beginning, you're not going to know much. So pretty much just learning how to be efficient and get through your tasks during the day so you make it home on time and you get to leave work at work, that's a lot more important than what you know. And then after you get your workflow down, that's when like adding onto your knowledge is a lot more important. You're not going to make the right decision for every patient. There's been many situations where I'm like seeing a patient and then I prescribe them medication, but then the next day I'm like, dang, why did I do that? I should have prescribed them this instead. It's like so much better for them. But that's also normal. The chances that you'll make that mistake again in the future is going to be a lot lower. And last thing, asking for help doesn't make you incompetent. This matters especially when you're dealing with what to prescribe a patient. Instead of being like, shy or stubborn and not asking your collaborating psychiatrist or a coworker about what you would prescribe for your patient, you kind of just guess and give them without asking for help. That's a lot worse than just being like, okay, I need a second to, talk over your case with my coworker, and then I'll get back to you on what we can do regarding your medications. Doing that doesn't make you incompetent as a nurse practitioner. It just means you're doing the best you can to make sure that patient gets the best care possible. Even if it makes you look like you're not the best provider, you're doing what's best for the patient. Now, obviously, you don't want to be doing that for every single patient that you encounter, but for things you genuinely don't know what to do, you should just ask for help. You're gonna take a little hit to your pride, but you're doing what's best for the patient, so that's what actually matters. And then lastly, what is my final advice for new grad NPs? Just expect to feel like you're not actually ready to be a nurse practitioner. You're gonna feel like that for almost the whole 6 months, if not longer. But you just have to remind yourself it's normal. Everyone goes through that. And honestly, sometimes you might never stop feeling like that. It's definitely a big transition from being an RN to becoming an NP. Just be prepared to feel overwhelmed, feel like a failure sometimes, feel like you don't know what you're doing. After 6 months, a lot of that feeling goes away, but it's still gonna be there here and there sometimes. You're definitely gonna think more about your failures than your successes. So if you start feeling like that, just think of like all the other patients who you've treated successfully, and then you'll start thinking about more how being an NP is more rewarding instead of being challenging. So my advice is just stick it out for at least 6 months and then see how you like it from there. If you have any other questions regarding how it is working as an NP, you can leave a comment down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I treat adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.